Live in 5, 4, 3, 2, 1. We are now live.
So good evening and welcome everybody to this very special webinar on post-qualification opportunities. And this is very relevant to postgraduate students as well as trainees. And we have eminent personalities here to help us give directions and guide the young students through this. So with this, I'll hand it over to our moderator, Dr. Ram Prabhoo, sir. Over to you, sir.
Thank you very much, Dr. Ashok, Shyam, for getting us together. And it's a great opportunity that you give us for sharing with youngsters today. We have very elite faculty who are going to enlighten you about various fellowships opportunities in India and abroad. And to start with, we have very senior orthopedic surgeon, Dr. Girish Devnani, who really doesn't require any introduction, but he has been trained in UK and he's got his FRCS, double FRCS there. He's also MS and DNB from India. And he has a vast experience in India and abroad, and mainly specialized in joint replacement and hip. So he is going to share his experience of UK fellowships, and he's going to tell you what are the opportunities which are present in UK. He would probably tell something about other places too. After that, we are going to have Dr. Tanay Prabhoo, who is going to talk about opportunities in India. Of course, there are plenty of opportunities in India also, and there are various different multi-speciality hospitals and corporate hospitals who offer lots of fellowships in different subspecialties. Then we have Dr. Pranav, who is good, Agrawal, who is also a consultant, is a trauma and joint replacement surgeon. He is going to tell us about more fellowships in Korea, and he's had his personal experience, which is going to help us in getting those fellowships. And at the end, we have Vandana Dandekar, who is the head of Quest Healthcare, and she's going to tell us what are the possibilities of getting these fellowships. And she deals with these paid fellowships, short-term and long-term, and probably contacting her will help you a lot getting there. So without taking much time, because we have Dr. Girish, who is very close to the God just now at Shirdi, and he is going to get us connected with God, who will probably help us to get fellowships. So over to you, Dr. Girish.
Can you connect a tablet, please?
Is there on the table?
Just connected. I can't get to the Zoom. Yeah.
Okay. Mobile phone.
Can you hear me? Anybody? Can I share my screen?
Yes, go ahead.
Right. Can you see me? Can you see my screen?
Yes, it's clear. Go ahead, sir.
Okay. Thank you very much, Dr. Ram Prabhoo, sir, and OrthoTV for allowing. Why do we want to go and explore training options abroad? Are we not happy with our whatever limited training we get here? And the answer is definitely not. And in the current scenario where there are such a huge number of increase in seats in the postgraduate courses, and the DNB has been diluted to some extent, giving it to rather large nursing homes where we don't get a hands-on experience as much as we would desire before we start our orthopedic practice. So orthopedic training outside India becomes a very important, if I may add, an essential part of your training to make you a well-rounded orthopedic surgeon, pun unintended. The reason being that exposure to orthopedics is more of how much you are seeing. Yes, that is important, but more so what you are doing. Because at the end of the day, we are not orthopedic physicians, we are orthopedic surgeons. So unless you get your hands dirty and do things which you would be expected to do in practice, you will find yourself woefully inadequate and lacking in confidence when you start seeing your patients. So hence, it's my earnest appeal to all of you who are in any sort of orthopedic training, whether it's a DNB or an MS, please don't start getting into private practice the day you finish your exams. You need to broaden your horizons, see what the world has to offer, get good surgical experience under your belt before you start clinical practice. So with that, let's move on to what my remit today is, and that is training opportunities in the UK. So the first question that comes to mind is, why UK? As I clearly said, we are not here to discuss getting into an observer post. We want to have training which allows us to get our hands dirty, and that is only possible. The biggest options available are in the UK because they accept Indian training. Now, what do I mean by accept Indian training? That is, they accept that you have done a couple of years, a year of internship, and then 2 or 3 years of orthopedic training, and they take that on board when they are offering you positions. And the second point is very important. Most of you who are seeing this broadcast might be harboring intentions of staying abroad as a permanent gesture, staying abroad in post qualification, and that's absolutely right. Absolutely a personal opinion. I have no particular hard and fast rules. I came back after 10 years of training and working in the UK, but I completely agree that many others would not do that in my place. So no other place gives you a chance of staying abroad. The road there is long, but it is still very, very possible, very, very feasible. You might land up staying there as a consultant, which is the ideal thing. Or secondly, you may land up doing what is called a middle grade job, which is not a consultant, but you are doing independent surgical work, independent outpatient clinics, and independent decision making, but under the cover of a consultant, something like what you would call a senior lecturer in our system. So there are options of both nature depending on which road you prefer to take. So before we discuss the UK training options, what does a graduate in the UK itself do? So once they finish their medical school training, the local graduate will do what is called an F1 and F2 post, which is like an internship. The F1 being specifically more like an internship, but they have a 2-year internship program. And then they move on to what is called core training 1 and 2, CT1 and CT2, wherein they will rotate through some surgical specialities, whether it be ENT, casualty, general surgery, orthopedics, etc. And at the end of the 2 years, they are expected to have their MRCS exam. So the MRCS exam is only an entry portal to constructive training program. You go on to do a 6-year training program, and then you get your consultant ticket. In the process, also passing your FRCS which is a exit exam after 4 years of registrar training. So that is, in short, what a local candidate would do. And what do we have to keep in mind is the GMC, or what we call the General Medical Council. Like the USMLE in the US, the GMC is absolutely critical to give us licensure to practice. So you technically cannot touch a patient unless you have GMC registration in the UK. You can go there as an observer, yes, you can. But if you want to do any surgical work or any clinical work of, say, which involves patient handling, a GMC is important. So how do you manage to get the GMC registration to allow you to start your training there. So there are three options, or rather, let's put it fourth. I missed the first one. The first is, of course, you can give the PLAB. The PLAB is the entrance exam in the UK, which is encompassing your whole medical career, medical school training. And it's a exam which is consisting both of MCQs and clinical scenarios. Or if you do not want to give the PLAB, then you give your MRCS, which is the entry exam to registrar level training there. Now the MRCS, luckily, is now being held in India. So you don't have to travel to the UK to give the MRCS. MRCS again has part 1 and part 2. Part 1 being the theoretical MCQ, etc. part. The part 2 being the clinical part. Now for the pandemic issues, it has not been held for the last 18 months to 2 years, but it will soon resume as the world comes back to normal. So the MRCS is a vital component of you wanting to start your training in the UK. Once you pass your MRCS, then you can apply for jobs, and then many hospitals will probably take you on at a middle grade level, may not take you on into a training program on day one. They will assess how you are, what they make of you. Please understand, the references that we accumulate in India does not make a toss of a difference to the British consultant. They will assess you and they will decide whether you are good enough to enter a training program. Yes, what helps is if you have a strong CV. So that means you must have some publications in reasonably peer-reviewed journals. You should be having an audit project if possible, some research which you are part of currently. So these factors enhance your chances after your MRCS to be chosen into a job there. You may get a 6-month job to start with, but then it is not difficult to progress, because then you have a 6-month job in which your consultant there gives you a reference, and that helps you get your next job. And if you are good and working well, they will absorb you into their system, which may be a ST3 level or even CT2 sometimes. But then you are in the system, and at the end of 6 years, you will get your consultant ticket. And if you feel, you can stay on in the UK as well. Sorry, I think I've lost my connection.
Yeah, Girish, please share again. Your slides were not moving.
Sorry. Okay. Can you see that,
Yes.
Ashok? Yeah.
Yes,
Okay.
sir.
So that's the MRCS route. The other route which we have available nowadays is the MCH route. Now, the MCH program has been ongoing in a place like Dundee for the last many years, but that's a 9-month student-based program. Your high fees and get an MCH degree without even seeing or touching a patient except in the clinical exam. 2-year job commitment, but the £35,000 in those 2 years. They are committed to give you a job, which means that you will be paid for those 2 years, and that's enough, in my opinion, to pay off your fees. Now, you do not require to do the MRCS if you are accepted for the MCH or the PLAB. Am I very clear? You can go on the MCH without doing the MRCS or the PLAB. The MCH exam system will get you the GMC registration for those 2 years that it is promising you a job. And at the end of those 2 years, you will get a MCH degree after, of course, passing that exam. If you want to stay on longer, after you finish your 2 years MCH, then you have to have your MRCS, which then allows you to apply for other posts all around the country. So the MCH is a good option for somebody who wants to go and get a flavor of what UK training and UK work experience is all about, and has no such intention or harboring any desires to stay for longer periods of time. The MCH is available to all our trainees. There are interviews held sometimes in India, sometimes abroad, and that if somebody is interested, can get more information from the University of Wrightington website. The third route of going is by what is called the MTI route. Now, the MTI route is that some hospitals, or rather some deaneries in the UK, have an arrangement which used to be akin to what we went as double sponsorship. Now, for that, again, you do not require any of your MRCS or PLABs. They arrange the GMC registration. But again, it's a 2-year program. The MTI is available in very select universities, and it keeps changing. There is no stability. Some place had it 2 years ago. Now they've scrapped it. So it's very variable. And I don't think currently it is not the most dependable route. So, but it is still to be kept in mind that if it opens up, it is something which your consultant here, if they have a good rapport with a consultant there, can set up this training program for you, and you can then go and work with that consultant for a 2-year period. And the third one is the IOA. The IOA also has a fellowship which goes to the UK. Again, not requiring you to pass any of these exams like the MRCS or the PLAB. Couple of centers have got a linkage of the IOA fellowship, and a couple of chaps in Bombay have done this. And I know from interaction with them that they have had extremely good clinical and hands-on experience and have been very happy with their training there. So that is another option, but these all are short term in the sense 2 years, and you will be asked to leave because they will not extend your visa because your GMC will not be valid. So the only way of staying on longer is you have to, in these 2 years, however you get there, have an MRCS, or you have an MRCS before you go there. So I hope that point is extremely clear, that the MRCS is critical and crucial for anybody who wants to go to the UK and wants to avoid the PLAB. The PLAB makes you study medicine, obs and gynae, ENT, and trust me, after doing a DNB or an MS in orthopedics, you do not want to go down that route and learn ECGs all over again. I'm not saying you don't know them. I didn't know it, but you know, that's how it goes. So that's the most important thing. Just a second. Can you hear me now, or have I gone mute?
No, we can hear you, but your slides are not moving.
I don't know. It says can't start video because the host has stopped me. So I don't know what. Host has stopped it. So I'm not the host. So I don't know whether Ashok has stopped me. Whatever. Okay. Okay. Now they're moving. Okay. So yeah. So that was what I had wanted to share about UK. There are a lot of subtle things which may crop up in anybody's mind. And my number is there at the beginning of my talk and at the end of the talk. And you can WhatsApp me and see. I can try and clarify whatever issues are there. So we are going to hear about the US in a later talk as well. But talking about working in the US as in hands-on work, it is available in plenty, but only and only if you have passed your USMLE. Yes, there are visa issues. So if any of you have a green card, then you are in a better position to do so. Residency and fellowships are two different options in the US. Getting a residency in orthopedics in the US without a US visa or the green card is pretty much impossible, if I may say so. Fellowships, of course, you can get, but you have to, again, CV. So going abroad is always better or enhanced if you have a good CV in your postgraduate training days. You must have a couple of good publications if possible, and that bolsters it better. If you have a research project, all the more better. Now, as far as staying on in the US is concerned, to my knowledge, there were a few states who allowed you to become an attending or a consultant by doing only 3 fellowships, while there are other states who will not consider you unless you've done a proper residency program. Now, again, as I mentioned for the MTI, this thing seems to be something which changes regularly. So you have to be aware of which states, if any, are allowing this. I know for a fact that New York City and its surrounding, there are a couple of colleagues of mine who have stayed on in the US after doing just 3 fellowships post MS and are now very successful consultants. While other states, they have been very clear that they have to do a residency training program. So that's where the US stands. Interestingly, the other Commonwealth countries, by which I mean Australia, Canada, and New Zealand, will take on board your MRCS, which you will qualify. But on that, if you have UK training, so let's take, for example, you have finished your MS or DNB, and you've done your MRCS, and then you've gone and worked for a year or two in the UK, and then you feel you want to explore options in either Australia, Canada, or New Zealand, you will be given a much better opportunity and a chance to get in. So the UK becomes an extremely good launching pad even for other countries in the Commonwealth, like Canada or Australia. So personally, I feel that if you want to go abroad and you want to get some hands-on training and you harbor the desire to stay on longer or maybe settle there, then UK is something which you need to look at and start looking at it early. Don't wait for your DNB to finish or your MS to finish. Start, maybe do your MRCS earlier, maybe year 2 or something. And then your MRCS part 2 after you finish your MS. And do not forget, publish or perish is the mantra anywhere in the world outside this country. Here, even if you don't publish, you still flourish. So that's not going to happen anywhere else. So with that, I will end my talk, and as I mentioned, my number is here. If anybody wants to clarify or ask, I'm more than happy to talk about the UK on a one-to-one basis. And yeah, that's what I want to say. Thank you very much.
Thank you very much, Dr. Girish, for your excellent insights into fellowships in UK and partly in USA. So there are a couple of messages from his talk. One thing is that with the training that we have in the postgraduates, many postgraduates, when they come out after the MS and DNB, are also pretty raw. And in case if they have some super specialty in mind, besides the centers that are available in India, I think some kind of exposure abroad is essential. And that exposure is not only in orthopedics, but other things, the soft skills, medical legal importance, the paper publishing, etc., which are inculcated right in the beginning of residency there, we have to get into it. Fortunately, all the faculty today have been trained in India and abroad, and they have excellent inputs to put regarding these fellowships. So that is the first message. Second thing is that there are basic requirements of visa, the basic requirements of passing couple of exams, and of course, many times the recommendations from consultants there are important. So what I would really suggest besides those paperwork is that whenever we have these international conferences here in India or abroad, the residents or those who are wishing to go abroad can get connected with these speakers who come here to India and probably get connected, keep in touch with them, and then ask them for some kind of observership or fellowship. So after having said that, I would now request Dr. Pranav Agrawal, who also is is going to put lots of insights into basically those fellowships which can be done in Korea. Over to you, Dr. Pranav.
Thank you, sir. I'll just share my screen.
I'll just stop sharing it. Thanks.
Yes, please. Can everyone see my screen, and am I audible clearly? Am I audible? Can everyone see my screen?
Dr. Pranav,
You're
go on,
audible.
and we can see your screen.
Thank you
Yeah,
so much,
we-
and good evening, everyone. I'm Dr. Pranav Agrawal. I'm a consulting orthopedic and joint replacement surgeon, and a lot of my practice is in the western suburbs of Bombay, and I work at the Lilavati and Arogya Nidhi hospitals. At the outset, I'd like to thank Dr. Ram Prabhoo Tanay, Girish bhai, Vandana madam, and all colleague speakers and OrthoTV for giving me this opportunity to talk to everyone about my experience of fellowship in joint replacement surgery and joint surgery in Korea. That's South Korea, not the one with Kim Jong-un. So when we set out, once we finish our post-graduation, generally we do come to a crossroads and try to think what can we do, where else can we go to polish our craft, to probably learn a little more in detail about the field that we want to specialize in. So I went to South Korea, and in South Korea, I was a fellow at the Chonnam National University Hospital. There are good 5 national university hospitals in South Korea. I was at one of them in a province called Gwangju in south of South Korea. Korea is probably about the size of Maharashtra state. If you just get a general idea, it's about the size of Maharashtra state, and Gwangju was probably at that time something similar to Nagpur of Maharashtra. But it was a culturally very advanced region, and the medical prowess of that city was very good, including its technology. So Chonnam National University Hospital was one of 5 university hospitals. This was in 2015. I initially worked at Hwasun Hospital, and Hwasun Hospital, incidentally, was voted 3 times in a row to be the best looking and best managed hospital in all of Korea. So they also had a beautiful cancer center at Hwasun Hospital, and a lot of people do medical tourism and go get treated for cancer over there. And it was a joint disease center. It was beautiful amidst mountains and a chalet. So I spent 6 months at Hwasun Hospital. This was the satellite hospital to a parent hospital in city of Gwangju. Then I moved on to the other hospital, which was also a satellite hospital called the Bitgul Center for Joint Disease. This was a 400-bed center dedicated only to surgery of joints. So they did everything, including shoulder surgery, elbow, wrist, hip, knee, foot and ankle, and everything. And this entire center was dedicated to joint surgery and other fields which will be required for taking care of joint surgery, including elderly patients and such. They had a lovely facility. That's the facility in the center that you can see. They also had a lovely vaccine center, which was part of the Hwasun Hospital, and they did a lot of work in vaccines during the time of Corona. You all must have read as well. That's a little bit about where I was. As Girish bhai has aptly put it, and Ram sir also summarized it, that we need to ask ourselves, what are we going to get from a certain fellowship or from a certain time in a certain place abroad? And let me point out a couple of things which I got from Korea, which you can get easily too, because it's fairly reliable and similar. Korea does a lot of quantity of work, especially the university hospitals where I was. So we would operate something like 35 to 40 knees a week and 35 to 40 hips a week. This was in different departments. I worked with both of them. So 35 to 40 knees a week, and they used to operate from Monday to Friday. On Saturday, they would keep only certain cases which required urgent attention, or certain revision cases or certain fractures, which they would operate on Saturday. Otherwise, it was a Monday to Friday operating schedule, and they would do 35 to 40. That's quite a lot, about 6 to 7 knees a day and 6 to 7 hips a day. Specialization in Korea is joint specific. So, for example, here an arthroplasty surgeon does arthroplasties of all joints, which can be shoulder, which can be knee, which can be hip, etc. But there, they used to specialize by the joint. So a knee surgeon would do all surgeries about the knee. That included arthroscopic surgeries, that included menisci and ACLs and PCLs and cartilage reconstructions, then move on to unicondylar arthroplasties, total arthroplasties, revision ACLs, and you name it, and they do it about the knee. For example, for the knee, when I did my fellowship in the knee surgery. So the kind of knowledge that you get about a particular joint is very vast. I learned more about the knee in my time in fellowship than I ever did during residency, because you understand a lot of things about disease of the knee and the treatment for that disease, and you're doing everything in that spectrum. So that brings me to the next point, procedural diversity. These people used to perform a lot of surgeries which were mentioned in the textbook, of course, for the correct indication. So what happens sometimes in practice in India is that we sometimes meter the treatment to a patient based on various other factors, which could include the socioeconomic status of the patient, which could include what hospital we are working in, which could include what facilities do we have at that time. But here it is important that we learn in terms of learning and training to do all sorts of procedures which are there for the correct indication. So that's what I learned. That's what they did. They had a lot of procedural diversity. They would do a lot of different types of procedures, and these patients benefited. Now, how could they get to do these things is because the patients were insured. The patients had government insurance and private insurance. They were dually insured, and university hospitals were even better than private hospitals in Korea. So the patients were easily accepting of the procedure. They would come earlier to get procedures done. They would accept the procedure easily. They would come earlier to get revisions done when they were in trouble. So overall, the acceptance of surgical procedures were very easy. And these were fancy hospitals, and even so, they were insured. So easily procedures were done. That helps us to see so many more procedures, to operate so many more procedures. So these are university hospitals. I mentioned about that. As far as data collection and research is concerned, I was in Korea in 2015, and at that time they were at the top of their game. For 3 decades running, they had started digitalizing all data, all records, everything was digitalized. And what they did was they got independent sometime around our time as well. And what they did was in this university hospital, all the files and paperwork that they had from the previous patients, they digitally copied it, they concised it, they zipped it and put it into records. And they could have access to any of these records at any time, which gives you the power of having data in hand. If you have data in hand, you can publish, as Girish bhai said, publish or perish. You can do research. You can understand where you are going, where your treatment is going. Does it need change? Does it not? So data collection was important. I'll tell you a very small story. The head of department, our head of department of knee, is a big man in navigated surgery. He was sitting at 7:15 in our hospital, and the senior resident was presenting the cases of the day, and he told him, "Sir, your patient who had been operated for ACL 20 years ago by you had come for follow-up yesterday, and he's doing very well." So the boss asked, "Let me see the first MRI images." So our resident said, "Sorry, we don't have access to that." So the boss asked, "You must have checked with our parent hospital." So he went and checked through this satellite hospital the records of the parent hospital, and he did not find. Eventually, the boss said, "If the patient has been operated in Korea at all, there will be records. You just have to look for them." And he did. And 2 days later, he had the entire records of that patient, including MRI scans, which was done 20 years ago. So this is just phenomenal. And just with data collection and digitalization, they are far ahead in technology as well. So we used to have access to a robot, and I trained in robotic surgery for the knee as well. Not just that, if you see on the right down, that robot which is there is a research robot, which was there in our hospital. And in the research robot, what you can do is you can put cadaveric knees, cadaveric hips, and the robot affords movements in 6 planes. And you can study the effects. At that time, we were also doing a lot of experimentation with kinematic alignment. So we would operate with a kinematic alignment on a cadaveric knee and then put it to the robot and see how it behaves. So this is the kind of technology that was already in Korea in 2015. Another important thing is Indo-Korean relations. And this is not a political statement, but our Prime Minister has made sure that he develops relations with various other countries, and that includes Korea as well. So I had given this talk a couple of years ago at VIROC, and at that time also they were inaugurating a massive statue of Mahatma Gandhi in the Indian Cultural Center in Seoul. So the Indian community is strong there. They are doing well. Indians are hardworking. Indians they are very fluent at English, which the Koreans appreciate. They appreciate their research talents as well. So they Indians help them publish papers, while these people teach us details about the craft, details about the surgery. So that is very good. In terms of hands-on, what Girish Bhai was mentioning in the previous talk, there is no formal hands-on training that can be given on paper. But when you're a research fellow, when you're an international fellow, when you start operating, automatically you start operating, you'll start first time you'll go and just paint and drape the patient and the boss will come in. Then you understand that you've already introduced the scope and then you've already understood. And sometimes there is a time when the boss is operating in a parallel operation theater and doesn't come in and you finish the entire total knee. So that's how they help you grow. That's how they help you work as well. Access to Korea is very simple. In my time, I had applied to the university, they had approved my fellowship, and apart from asking for some of my documents, everything was taken care of at their end. So the visa was applied by the university, the stay was taken care of by the university. When I landed in Korea, a senior fellow of the boss also came in to help me, to pick me up from the airport, and they're very warm people, they're very nice people, they take care of you. So access to Korea is much easier as compared to some of these Western nations. There are many hospitals and there are many vacancies. So in terms of specialization also, you can specialize in spine surgery. They're doing a lot of work in hand, spine, pediatrics. My colleague specialized in pediatrics in Korea as well. And there are certain consultants who work with good private hospitals in Korea who also offer fellowships. So learning and experience is quite a lot in Korea. When I was in Korea, at that time, they were collaborating with the University of California, Irvine, to do a detailed study in kinematic alignment in the knee, and I was supposed to go there. Unfortunately, that thing did not work through, but there are a lot of opportunities from Korea. Once you have a Korean fellowship, it's fairly known elsewhere as well, and you can move on to these other fellowships easily. When we plan to go to a certain place, there are certain common concerns, not just about learning, but also about feeling your way around, comfort of learning, comfort of staying, and such things. And the common concerns which most people ask me, which I had in mind also when I went, was language of instruction. Do we need to learn Korean? No, not really. Now, Professor In Kyu Song was my boss. He was a very senior and accomplished knee surgeon who did a lot of work in navigated and robotic knee surgeries as well. And he was president of various international associations of knee surgery in the past. He's now retired, and the assistant professor is now become the head at my institute. So these professors, the seniors, they are all trained in US, so they are very fluent at English. Now I'll tell you one small story. The assistant professor at that time, I used to share the office with him when I was his research fellow. And there was once upon a time in kinematic alignment, I asked him a rather difficult, complex conceptual question. And so he tried to explain the answer to me, but could not really communicate the detail in English. So what he did was, in the next week, he told me to review certain articles which he was supposed to do for their Korean society and such, English articles. And at the end of that, when I reviewed all those 3-4 articles, I realized that all those articles were pertaining to my question, and he had answered my question and left a little bit for me to imagine as well. So this is the way that they taught. He never let it go because he could not explain. He let me review 4 articles and I got my answer from that. So the language of instruction is good. Food for vegetarian people is definitely a problem because a lot of their food is non-vegetarian and seafood. Certain colleagues of mine who are non-vegetarians also had a little problem because, Korean and Japanese food has a relatively, you have to have a taste for it and you have to develop a taste for it. So it's not easy. But you look at that table downstairs. This is a specialty of food in Gwangju. And look at the elaborateness of the food. And these people were very warm. We used to go out twice a week with the department to have lunch or dinner. And it used to be a very warm and nice situation. And you can learn about their culture. You can get used to it. Eventually, when I came back, I could not have food without my kimchi. Jokes apart. What about pay? So at my time when I was there, my university used to give me a small stipend. There are certain other universities in Seoul and such which used to give a little more stipend. But my university used to take care of my stay and electricity bills, conference charges, and such as well. So they would pay a little less stipend, but they would take care of all these things. However, it was good enough to stay peacefully and have no problem at all. Seoul would be about as expensive as Mumbai is, probably a little more. But food and regular life is extremely affordable. There are some people who would like to travel and settle abroad. Is it easy for the family to settle abroad? I would say it's a little difficult because the Korean education system and the Korean specialization system is very different. They don't use the English alphabet, so it is not easy to take on the Korean language. I'll tell you a short story of a couple who I knew. They were doing their PhD in microbiology and they were working at the vaccine center. They had a 5-year-old kid. Now the 5-year-old kid started going to school in Korea because they were decided to settle there. And he would come back and sing advertisements in Korean language and songs in Korean language and speak to them. And these guys had no idea. So the father had started taking Korean language classes to understand his son. So that is it's a little bit of problem because of the language does come in with the locals. So I would say it is not easy to settle in Korea. You need to go there, do your fellowship, learn your craft, learn the surgery, polish it, and come back. As far as patient management is concerned, the bosses can instruct, can tell you what they do, but regular patient management is better learned in India when you come back and practice here. These are some of the memorable moments that I had in Korea. If you see that video, I'll see if it's working. Yes, it is. This video is the robot that they had in their times. It is a RoboDoc. And that gentleman over there with the specs is my fellow colleague from Korea who finally went on to do 6 months of military work as all of them are supposed to do. So look at that. We all stood there and appreciated and clapped while the robot operated. But it is just a mind-blowing experience to see the robot in those days. And now robots have started coming into practice in our city as well. In the right top is Professor Yun Kyu Song, head of knee surgery, and the right bottom is Professor Tekrim Yoon, who's head of hip surgery, and he has some very fancy articles and research work in field of hip surgery as well. So all in all, I think that my experience in Korea was a rather enabling experience in terms of knowledge, in terms of surgical craft, and in terms of application back at home. There are some people who would ask if another fellowship or if further experience is required. And I would say to that yes, no amount of experience is ever enough and no amount of learning is ever enough, but you have to take the plunge sometime. And I feel that in my practice this day, back in Bombay and back in India, I think the Korean experience was very, very good and it was fairly thorough. So if you spend about a year in Korea in probably 1 or 2 departments, say knee and hip surgery, I think it would be sufficient. A couple of months more and I think that would be very good, and you can come back and polish your skills about patient management back in India. So I think all in all, my experience was good and I would recommend everyone to go ahead and get their experience in Korea. I can help you out with some leads. I'm available for taking questions and you can reach out to me at any time. And wishing all the younger orthopedic surgeons all the best. Over to you, sir. Ram, sir.
Yeah, so thank you very much for such exciting and futuristic fellowships that you did. And I think that will help all the youngsters to think about going. Couple of questions that I would like to ask Dr. Pranav is,
yes, sir.
From the time of application to getting the fellowship, how much time did elapse?
Sir, I'm extremely indebted to Professor Dr. Mohanty because during my tenure, when I was doing my senior registrarship and clinical assistantship at Nanavati post my DNB, at that time, when I was applying for these fellowships abroad, there was an opportunity at this center And the boss said that he can recommend me, and he did. And it took about 4 to 6 months after that, and I just flew.
Yeah. So
So I think
normally,
I must have applied. Sorry.
how much time it would take for the person who doesn't have any contacts or doesn't have any mentor like Dr. Mohanty?
Sir, it could take sometimes a year. It could take 2 years as well. Sometimes there are a lot of applications. See, I had Indonesians with me at the time that I was doing. These people on the screen are Indonesians. I had Malaysians doing their fellowships and Indians. So sometimes when they have a lapse, they might even request you to come on sooner. They're very warm and very considerate that way. So to give an exact time is not possible for me, sir, at the moment, because I'm not really sure how much time it is taking now, especially post COVID. So,
So,
yeah.
so is it possible for somebody who is doing postgraduate, I
Mhm.
mean MS or DNB, to apply so that they remain on a wait list, and as soon as they finish, they can get this?
Sir, as a matter of principle, I would advise younger orthopedic surgeons to start applying to all these posts from their second year of residency itself. And
I
you
think
know,
that's great. Yeah, go
sorry,
ahead.
when I had applied, they had requested me to come over in December, and my post was getting over in February. That was a month and a half after they were expecting me to come. So I
Okay.
wrote to the professor and I said, sir, I'm committed to this post which gets over in February. Is it okay if I join then? And they were more than happy to accommodate me. So
Hmm.
even if they get an opportunity and if they are committed to a certain post here, then these people are more than happy to accommodate. So they are very warm, very friendly, very accommodating that way.
What about the climate? I mean, which months are better to visit Korea and your center?
So Korea is somewhere between China and Russia. South of Korea is Japan, China, and north of it is Russia. So it is in the northern aspect, and they have a good cold winter. They have a beautiful spring with cherry blossoms. They have a lovely summer, and they have autumn and winter again. And while I was there, sir, I had the opportunity to experience all weathers. And the boss and the team would help the foreign fellows to be with them on various such things. So in summer, we would go trekking, whereas in during snow, we would go to a ski resort and have dinner and such. So it's a very
Wonderful.
pleasant experience.
So you have study and you have wonderful work-life balance during the fellowship.
Yes, indeed, sir. And in fact, as part of Professor Yoon's ideology, once in a year, he would take all his patients that have been operated for hip replacements to a trek. So Korea
Wow,
is a land of mountains. So they do a lot of trekking. Even senior people, 60-year-olds and 70-year-olds, would pack up their equipment and go trekking. So
wonderful.
this would be part of the departmental thing. So it was a brilliant experience.
Yeah. So just to give you this thing, because I had some of my residents who went to Korea,
Hmm.
and regarding the money part that you talked about,
Hmm.
there are lots of younger students who like to learn English,
Yes.
and these people taught English in their free time,
Hmm.
and they could get some amount of payment for it.
Oh,
So
that is
that
nice.
helped them. Yeah.
Oh, that is
So
nice
that,
indeed. Yeah.
yeah. So those online English classes help them to
Huh.
tide over their hobbies. They could continue like what you did for skiing and mountaineering, etc.
Yes, indeed,
So,
indeed. And that is
so
that
that
is a
was
pleasurable experience.
so. Otherwise, I think they. So just tell me, what do Koreans get out of giving this fellowship? Just tell me that. I mean, what are the advantages that they have by offering these fellowships?
So, like I mentioned, they are big into data collection, they are big into research, and they are big into publication, just like any other Western country. And at the time that I was in Korea, they were in Asia, they were number two. They were just behind Japan in publication and research. And they would really go to long lengths to understand, to research many things. Like one of my protocols was to study kinematic alignment. And one day, what happened was that I presented a rather detailed concept to the senior boss, and I said, "This is how we should do it." So he murmured to the assistant professor, and then later I asked the assistant professor, what did the boss said? And he said that boss told me to make whatever it is available to Pranav so that this research can go ahead. So engineering help, robotic help, CT help, let money help, do whatever. If he has this concept in mind and this concept looks good, let's just push it.
Okay,
So,
wonderful. I think
yeah.
We have people like Pranav going to Korea, and that's the reason why the later on fellowships are easier. And I think Indians make a mark in not only being sincere,
Very
hardworking,
hardworking, sir.
at the same time give inputs and help them to publish papers. And publishing is extremely important for anybody's future. And
Yeah.
that is what you must remember, whether it's in India or abroad, document your cases and publish them as much as possible. And that
Yes,
is
that
the
is correct.
message that Dr. Pranav would like to give. Thank you very much, Pranav, and keep online because people might ask you questions.
Yes,
Now
sir.
we come to a very young spine surgeon from Mumbai, Dr. Tanay Prabhoo, who, having gone through all those processes of getting some fellowships in India and abroad, have got a very much insight into how and what are the opportunities which are there, what are the possibilities, which are the specialties that people should look into. And I would request Dr. Tanay to please share his screen and talk about it. Thank you, Tanay. Over to you. Tanay, can't hear you. I think you are muted. Unmute yourself, please.
Yeah. So very good evening to everyone and all seniors as well as all our young doctors who are in this program. Thank you, OrthoTV, Dr. Ashok Shyam and Dr. Neeraj Bijlani to giving me this opportunity for presenting and being a part of this program. I'll be speaking about after a lovely talk by Dr. Devnani regarding the opportunities in UK and a wonderful talk by my colleague Dr. Pranav and his experience in Korea. I'll be speaking about the opportunities for all the postgraduate students in India. So the goal of education is understanding and the goal of training is performance. It was very well said by Frank Bell. And the great Muhammad Ali said, I hated every minute of training, but I said, don't quit, suffer now and live the rest of your life as a champion. With these inspiring words of the great Muhammad Ali, I will continue talking about the opportunities. So in spite of having a coveted degree in orthopedic PG, that is the MS, DNB or DORT, which has almost taken a decade of your precious life, you are at crossroads. And always there is a mind what to do next. And that is what is in each and everyone a PG's mind, and it was also in my mind too. So the questions which usually arise in the mind are, should I specialize further? Should I do something like a FNB fellowship, which is the fellowship of National Board, as most of you must be knowing, in a super specialty or not? The common fellowship which are there in the FNB are, one is trauma care, arthroplasty, spine surgery, hand and microsurgery, and the sports medicine. There are, of course, more and more new coming up, like the infection oncology. These are broadly the ones which are in today's time. If yes is your answer that you want to super specialize, this will cost you another 2 years of your time at least. How do you achieve this? This is achieved by giving the qualification exam of the FNB, which is the FNB entrance exam. After that, you have to really work very, very hard, work almost like 24/7 and to 2 years of the specialty chosen by you. Else, you can also do other fellowships which are there in India, which may be in different boards under the subspecialty. or under a good surgeon or a good mentor, which can be any part of in India. And you have to choose the center very, very well. These fellowships usually range from anything from 6 months to 2 years. I did an Indian fellowship, which is the ASI fellowship, which was for 2 years. As already mentioned by Dr. Pranav and Dr. Girish sir, that you have to do a fellowship abroad. You can do, it can be observership or a fellowship, which can be a research or a clinical one. So that is also a part of which you should think in mind later. So mentor is a very, very important, and it'll the person who trains you well, and that will really help in your practice later. The other options which can be thought in mind are to do general orthopedics, be a good trauma and good trauma surgeon. To get this opportunity, you can either be a full-time teacher, which can be in a government hospital, just like in Mumbai, for example, in KM, Sion, Nair, or JJ Hospital. In private hospital setups like Diva Patil, MGM, or Terna. Other one is honorary teacher, where you can do a part-time and you can be associate like in private hospitals like the Diva Patil Hospital. Just to give an example, which is associated in Mumbai, similarly in your respective cities. Secondly, you can also join and do private practice. So this is broadly into 3 different places. That is, first is the Tier 1 city. Example, like in Mumbai, big metropolitan like Delhi, Chennai, Kolkata. You can either do a consulting practice and operate in a corporate hospital or a private nursing home. Secondly, you can also do a nursing home or a yourself, you can do and start yourself. Or you can do a group practice, which can be of your fellow colleagues, example, 4 of your colleagues, doing different subspecialties. The common ones which are there is like the trauma. You can go someone doing the arthroplasty, that is replacement, scopy, arthroscopy, spine surgery. And if there are other people who can join for the hand, oncology, or infection. So this is usually in Tier 1 city. In Tier 2 city, you can also opt to work. Example, like cities like Nasik, Guwahati, Indore, Jodhpur, and Tier 3 cities, where it's even more in the interior, just like in Maharashtra, Ratnagiri, Chiplun, in the south, Gulbarga. So you have to decide whether you want to be a king in a small place and establish yourself much faster, or you would like to be a commoner in a big place. The choice is yours, and that is what you have to decide. The other options are also that you can work in rural areas, tribal areas, where the need for your talent is a lot there. The people over there need you, and you can really give and train as well as use your skills and help those people. Go ahead if your wants are very, very nominal and the needs are few. You must also have devotion and aptitude to social work. I'm lucky because I've been trained in spine, and my fellowship in Spine Foundation. One of the centers which I regularly visit is the Gadchirli Center. Is also known as the Search Center. I would like you all young orthopedics people to search about this, and you can see the beautiful, and if possible, please go and visit it once. It's growing and it's becoming better and better every year. Gadchirli is a Naxalite area, but the center is beautiful and a lot of good clinical work is going on there. So you must have a lot of devotion to social as well as aptitude to that. The other aspects, and if you are interested, you can be and join as an administrative in charge of an orthopedic hospital by doing your master's in public health. Finally, you can also join the Army Medical Corps, where your skill is much needed during especially wars. So either in the Army, in the Navy, or in the Air Force, you are needed. If you are really, really keen, this is also a great aspect you can think of after your orthopedic PG. There are another thing which is coming up new. Those who are interested in research, you can do a combination of DNB or MS, that is the master's program, along with the PhD, which is known as the dual program. This makes you a ortho research scientist, example in the bone disease and oncology. You can also do master courses in the medical technology, which is also available in IIT Kharagpur. This is also a very good thing option, those who don't want to do clinical practice, but want to go only in research work. And lastly, I would say you can also volunteer in MSF, that is Medicine Science Frontier, which are a group of people who go to different places in the world, and they help out in doing surgeries, orthopedic surgeries, sometimes some places where there are global disasters. One of my PG teachers went to Haiti when I was doing my PG training, and he had a wonderful experience, and he could really serve all the people. So it also gives an opportunity to travel to the other parts of the world. So if you are really interested, you can search about MSF and be a part of them. So finally, I would like to say that it is what you want to do. The decision making is you. Think peacefully after you finish. That ask your inner self, what would you like to do in your life? What suits your personality? Maybe one person is totally different from the other. So one person would like to just do clinical practice, private practice. Someone would like to do a research work, while someone would like to go to the rural areas and work. So your capacity for doing social or rural work is there if you're interested, or uprooting yourself and your family every 3 to 5 years. If you're in an army job, you can be posted at different places. Finally, I would like to say, ask yourself, what will make you happy? Go by your choice, go by your gut feeling. I'm sure you all will succeed whatever you choose. So all the best to all the young orthopods. I'm happy to help you out in whatever way I can. Thank you so much for a patient hearing.
Thank you very much, Dr. Tanay, for giving so many different aspects. Even I had not thought about few of the options that you gave. And I think people will start thinking about those options like research. They'll start thinking about doing some social work. They can actually visit some places like this. And also MSF, I think that's a great idea. And you can get handsome paid in such places. You can go to some developing countries and do work. And there is a lot of quality work you can do. You will have plenty of chances of using your clinical skills, but you are on your own. So you may have to develop that. So you have to organize camps, etc. So but I think that's a very good way of managing this. And that really helps us to find out what are the possibilities of doing post-doctoral your career development. Thank you very much, Tanay, for getting into it. And I'm glad that you're also doing so much social work, going to Gadchiroli, doing some spine, not only in Mumbai, but at the same time in Tier 3 cities. So all the best to you. And now we have the last speaker, none other than Mrs. Vandana Dandekar, who, along with whom I thought about mentorship program, and I got that into Indian Orthopaedic Association. We have so far mentored more than about 500 orthopedic surgeons across India. What we do is facilitate the mentors and facilitate the centers along with the people who are wanting to have this mentorship or fellowship program. And that is how it has helped. IOA is a great platform so that you can get into IOA platform and take help. In case if you have any difficulty, you can always get in touch with me. Over to you, Mrs. Vandana.
Is my voice audible? Is my PPT seen?
Yeah, it is seen, but slightly echo.
Okay. Let me just see what I can do. Yeah, let me just share my speaker view, and I will share my PPT. That's right. So good evening, everybody. And thank you, OrthoTV, Dr. Ram Prabhoo, and all my colleagues for giving me this opportunity to share what we can offer to you. So when Dr. Ram Prabhoo spoke to me about today's session and that he wanted me to speak to you all about short duration learning opportunities, which we have been doing for last 10 years or so. Idea is to give practical surgical exposure, but we also have, by actually going for fellowships, but we also have some online courses. So I'll quickly go through what we have. So we have domestic and international exposures, I would say. Options are, we can start with an observership, clinical rotation, fellowship. These are different options. Now, as we go along and as you
Madam,
graduate or as you...
Yeah, your screen is not seen. Are you sharing a screen?
Yeah, I am. You're not
No,
able to see it?
No, we can't.
Okay, let me try and do that again. Are you able to see it now? Are you able to see it now?
Yes, we can see your screen now. Please enlarge.
Okay, that's what I'll do. Are you able to see it now? Full screen? Dr. Ram?
No, make it. Yeah, now it is full screen.
It is full screen, right? Okay.
Please,
So
go ahead.
when we started with giving clinical rotation or the fellowships, as I would say, many times it so happens that when we send a fellow to the hospital, sometimes their existing experience is less. And therefore, sometimes the mentor will say that I'll start with an observership. Then you graduate into clinical rotations. Then you graduate into fellowship. So when we say fellowship, the connotation to that is long-term. And so far with the speakers who have spoken before me, have all spoken about fellowships, which is a long-term arrangement where you work under a mentor. But what we are doing is, we are doing 4 weeks clinical rotations, or we say a fellowship, sometimes clinical rotation. What the title would be depends on your existing experience. And I'm assuming that today's audience is all who have probably less than 3 to 4 years clinical experience. So therefore, it would be more like a clinical rotation rather than a fellowship, or it could also be an observership. So we have these, and I've also mentioned that it is 4 weeks duration. So the period is very short to talk about stipend or being paid anything. In fact, you need to pay for these learning opportunities, but these are very, very focused opportunities. So one needs to make sure that you know what you want to learn when you come to us. The next is, when we talk about orthopedic fellowships, I remember that 10 years back when we started the fellowships, the fellows or the students who would come to us would talk about orthopedic in general. Then couple of years later, people started talking about joint replacement surgery fellowship or clinical rotation or orthoscopy or sports medicine or spine or trauma or pediatric. So from orthopedic, it narrowed down to these subspecialties like joint replacement or orthoscopy or so on. And recently, we have come to a place where now our students who come to us start talking about even more in depth, or I would say super specialty level, where in case of spine, from orthopedic to spine to open spine to endoscopic spine, now down to UBE, PELD, PSLD. So we are the field in which you are coming to learn is narrowing down. I am assuming that the experts are narrowing down their expertise or their practice areas, and therefore the subspecialties are coming to becoming more and more narrow. However, we have the entire spectrum. So if you are let's say running an orthopedic hospital and you want to get the entire exposure, then you can come to us. If you want to specialize and want to become a joint replacement surgeon, then you can come to us. Within joint replacement, if you want to say that I want to do only robotic surgery, that also you can come to us. Within spine, if you want to come and say that you want to do endoscopic spine and then later on want to do UBE only, even that is possible. So this is what we can give you. And therefore, I said that you need to be very sure as to what is your objective, what is the purpose, what do you already know, and what is it that you want to learn. So this is how we have been offering our services to get you the right kind of or appropriate learning opportunity. So how are we doing that? Who are the people who we work with? Which are the hospitals we work with? We work with many hospitals. We work with many mentors. Max in Delhi is one of our partners. So all Max locations are available. In Pune, Lokmanya is available. In Bombay, Nanavati, we can do the fellowships at Nanavati. Down south, we have Be Well. So we have relationships with hospitals where you will be able to work with many mentors. Or we also have specific relationships with many expert mentors like Dr. Ashish Babulkar is in Pune, or Dr. Arvind Bave, who does spine, Dr. Ramnik Mahajan, who does knee replacements, and so on. Dr. Narendra Vaidya, who does robotic surgery. SKS Maria in Delhi at Max is a scopy surgeon, and so on. Dr. Pradeep Bhosle does everything. He's the head of department orthopedic at Nanavati Hospital. Dr. Bhushan Garnveer is located in Pune, and he does knee surgeries and so on. So we have multiple mentors. In fact, we always also tell you that if you have an ideal mentor with whom you want to do the fellowships, reach out to us. We can try getting you the fellowship with him, because we have been associated with many experts through whom we can go. The other thing that I would also like to suggest and explain to you is some of our mentors. I have been talking about short-term fellowships, but some of our mentors select their long-term fellows from the short-term fellowship students who go to them. I remember Dr. Ashish Babulkar once telling me that I give for 15 days free observership. And then he was very frustrated because sometimes, because it's free, students don't turn up and somebody else is missing that opportunity. So that is when I told Dr. Babulkar that no, make it paid. Do not charge obnoxious amount of money. We are not out to make money, a lot of money out of you, but we want you to be serious about your fellowship. Once you schedule something with Dr. Babulkar, he is very, very keen teacher. And I'm sure many of our mentors would think like that. And I'm sure some of you who are also in this session would also think in the similar manner that when I go, I want my mentor to be sincere about teaching me, but I want the mentor also to expect the similar thing from you. So we have Ashish Babulkar, who has been taking long-term students from us, and Dr. Arvind Bave also does similar thing. Dr. Bhushan Ganveer also does similar thing. Not just that, they are also giving recommendation letters for the foreign fellowships with their available connections with the foreign experts. So that is something that also happens with these mentors. I'll go on to the next slide, where this you can see the certificate, the kind of certificate that gets is given to you once you successfully complete the rotation. It is not given if the rotation is not done in a sincere manner. If you disappear, go for movies, then you will not get your certificate. So one needs to be very, very sincere. A logbook needs to be filled. So one more thing that I would also like to share with you is these fellowships are also in a way teaching you what to expect from your fellowships. So especially when you're going outside India for a fellowship, what should you be expecting from your fellowships is also what we sort of prepare you for, I would say. So these two these two doctors who have gone for fellowships have given their feedback. Well, Dr. Rahul Parmar says that it was a really good experience, as I got to scrub almost every day at Dinanath Mangeshkar Hospital, Pune, and I got to speak and discuss with 5 other faculties, including Dr. Amol Rege. I have learned more things about minimal invasive spine approach and vertebroplasty and endoscopic spine surgeries. Whereas Dr. Abhishek says that sincerely appreciate about Quext in their ability to help in guiding me at every step since I applied for it. Words fall short to describe Dr. Babulkar sir. He is a wonderful teacher, inspirational, driven, talented. I have learned a lot under his guidance, through which I can tell that I am much more confident in my clinical practice, and I'm very impressed and looking forward for fellowships with Quext. So why do people say that it was a good thing that they approached us, and through us they have gone for fellowships? And that I'll tell you in the next slide. We play a vital role in helping orthopedic surgeons get appropriate learning opportunity. So we have to understand what is the purpose that you have in mind. We have students who come from tier 2, tier 3 cities where they do not have good exposure to the surgical infrastructure. So some of them want to come to understand how to set up a proper OT, or what instruments to buy, how do you go about, putting the hospital together. So that could be one of your objectives. People who are in big cities like Bombay or Delhi or things like that, they want to get international exposure. So everybody's objective, or somebody is saying that I want to first learn endoscopic, like I said, and then move on to more super specialty level. So if your objectives are very clear, then we are able to help you in a much better manner. We have had students who have done 3, 4, 5 fellowships in this manner, or rotations in this manner, year on year. So the person first time came to us saying, I've just done my MS, DNB, or whatever that is, and I want to get more practical exposure as to how to handle, how to counsel the patients, including that, and how to set up. And then subsequent year, the person comes back to us with more specific learning objectives and so on, and ultimately probably would go for an international fellowship. Let me also share with you one experience of international fellowships. We were doing, last 2 years we haven't been doing, but before that for about 4, 5 years, there were students going to Switzerland for orthopedic fellowships quite regularly. And the first student who went, he came back very happy because he started getting the hands-on experience right from the first day. So we were very happy that the student came back happy, learning whatever he wanted to learn. The second student went, he was there for a fellowship for 2 months in Switzerland and came back not participating in a single surgery. Now, how did that happen? And that's when we learned, and this was probably about 6, 7 years back. That is how we learned that how important it is. First thing is to do fellowship in India, to know what to expect from a fellowship or your clinical rotation. Second thing that we understood was the first person who went knew he had already done one fellowship outside India. So he was very sure that on the first day, when you go and visit the hospital and when you meet the surgical team, how you should introduce yourself, they should know about your skill set properly. You must document your CV properly. You must write your experience properly. You must how to present your statement of purpose. All these documents are very, very important and are gone through diligently by your mentor outside India. They want to understand you. Yeah. The other thing is, if there is typically, especially in Switzerland, what we noticed is if there is a surgery on that day, the entire team gets together to discuss the surgical procedure threadbare, including the anesthetist, including the nursing staff, including the OT assistant, everybody. At that time, if you do not participate, they will start talking in their language and they will just go ahead and they will probably ignore because they think you're not interested in learning. So we start training and explaining to you all these little things which are going to help you get your fellowship experience to the best possible experience. So that is what we do. We guide you to represent your experience, remain focused on your learning objectives, because if you write your learning objectives, they want to make sure that your objectives are met. In fact, in some of our fellowships, the students have to make a presentation on the last day, giving the feedback as to what they came to learn and what they learned. So that is something that you need to understand these things. Then we also play an important role between your mentor and you, because there are some expectations that you want to set with the mentor. There are times when the mentor wants to give some feedback and probably doesn't like directly giving it to you. So it becomes easy. We can mediate. If there is a problem, we can sort it out. Sometimes the mentor wants to suddenly he's been called to go and participate in some conference, so he's going to be away. Then we need to talk to him, get you to work with other experts in the hospital or whatever. So all these things can then be taken care of. So that is the role we play. And for that, and that is how it becomes a paid fellowship. So something gets charged for the services that we give. We also help you with making stay arrangement locally. If you don't, we also get the documents like your indemnity insurance. Typically, the hospital in which you want to go for your clinical rotation or a fellowship, the HR department in that hospital wants to have proper paperwork done. Like Max in Delhi says that if they want to get hands-on, then they have to have a DMC registration. So that is something we want to do. When we have international fellows coming into India for fellowships, then at that time we also need to get their temporary registration done because they're coming into India. So some of the outside India fellowships also have some documentation requirements like this. So that is also something that we help you with. So like Dr. Pranav has said, or Dr. Girish also said the same thing, that you need to start thinking your fellowship. You need to start thinking about your career plan. You need to understand what is the specialty. If you want to become a specialty focused practice, then you need to also start thinking about what is the specialty in which you want to go, so that these small short-term fellowships give you insight into what is it that you want to choose, what is it that you want to go in for. Or there also have been sort of transition clinical rotations where somebody who has been doing all along open surgeries want to now get into endoscopic surgery. It's a different technique and one needs to learn it. And I remember Dr. Arvind Bhave when I was talking to him, because he's a spine surgeon, and I think he got trained in Vuridul Hospital, which is a very large spine hospital in Korea. So he was telling me how he was taught the endoscopic surgery and how fine that the entire experience is of learning. But somebody who's been used to looking at the patient and doing surgery, how difficult he's going to find it to do endoscopic surgery, and somebody wants to transition. So all these kind of experiences one can get and through a short-term fellowship with an aim to do long-term fellowship is what I would say. That is the purpose of these short duration clinical rotations or fellowships, as you might call it. So this is what the process we do, and we help you. Besides these, I would also like to introduce, because all of you are orthopedic surgeons, we are currently in the process of updating our small course in Introduction to Orthopedic Oncology, because oncology is something that you really need to put in a lot of efforts to learn, like all other specialties as well. Dr. Manish Agrawal is updating the Orthopedic Oncology, Introduction to Orthopedic Oncology online course just to understand. And that is the purpose of this short online course. We also have a certificate course in primary care rheumatology. This got developed specifically because of many requests from orthopedic surgeons, because you get joint pain patients who are actually rheumatology patients. So you need to understand the disease. Sometimes you can probably, if it's in the early stages, you can treat or refer them to a rheumatologist. But it would be nice to understand rheumatology as a subject, which I believe is not taught in much detail in your orthopedic studies. So we have a short course, but I would still say it's pretty exhaustive because there are 60 lectures. It is all practical oriented course. So we have these two courses which I put on top because they are relevant to orthopedic surgeons. Many of the students who are joining these courses are orthopedic surgeons. Oncology, of course, is meant only you can join this introduction to orthopedic oncology only if you are qualified orthopedic surgeon. So that is the criteria for giving you the course, giving admission to this course. Besides these, we also have these other three courses, which are online courses, which is medical aspects of obesity management. There are a lot of orthopedic surgeons would have patients who have the orthopedic problems are due to obesity. So we have had students, orthopedic surgeons, doing this course as well. Then we have diabetes management and infectious disease course. Infectious disease course also is, both these courses are pretty exhaustive, about 70 lectures, and we keep update. The other thing is these online courses are perpetually being updated. We keep updating all these courses, and therefore we don't distribute the material. You have to go online and learn these courses, but we have excellent feedback for these courses as well. So this is all that I want to share with all of you. That's our contact. Those are our contact details. We have a website, quex.com. So please visit the website. There are feedbacks. We have lots of references from every part of India where students have come to us for the fellowships, clinical rotations, online courses. Like Dr. Ram Prabhoo has already explained that in last 10 years, I would say probably about 5,000 to 6,000 orthopedic surgeons have taken advantage of these learning opportunities. Do get in touch with us. And thank you very much for giving me this opportunity to talk. Thank you, Dr. Over to you.
Thank you, Vandana, for excellent presentation. And as I told you, this is not regarding postgraduate. We are surprised that even seniors at the age of 40, 45, 50 also like to update their skills and want to get into some mentorship program. And we were actually surprised that so many of seniors also would like to take some kind of courses. And because of this, that we are constantly updating these courses, that they are attracted to this. So I think that was a great presentation, Mrs. Vandana, and those who wish to get in touch with her, because this fellowship sometimes can be the whole procedure of getting those fellowships are complex regarding the paperwork, the visas, the insurance, etc. So I think we need to have some specialized person like Vandana who could help us in those aspects. Otherwise, we are lost. Sometimes it's called a fellowship is 1 month, but then the whole paperwork can take about a year. So you can't get the time then when you require. So thank you very much, all the faculty, eminent faculty. That
Dr. Ram Prabhoo, one more thing I would, just 1 minute, I would like to also add that we are doing now, slowly things are coming back to normal, and we have opportunities that we can offer in the US, in UK, and many other, Spain. So these are international fellowships are also opening. So those who would like to explore the possibilities, do get in touch with us. Now things are improving. Visas are getting now approved. So do let us know if you are interested.
Yeah, so good. Your presence is globally present, Vandana, and I'm sure lots of youngsters and seniors like me are going to take advantage of your knowledge and your expertise and your helping nature in people. So today we had a wonderful session, having great eminent faculty of, to start with, Dr. Girish Devnani from Shirdi, Dr. Pranav Agrawal, who is in Mumbai, very much a Mumbai lad, and one of my favorite youngster. And he is a multifaceted orthopedic surgeon doing joints, and he sings well too. So probably if you need to learn singing, you can go and take one short fellowship from Pranav.
That's nice.
And then we have Dr. Tanay, who also is a great music enthusiastic, and he is playing tabla for last almost 30 years. He has a great sporting talent. He played nationals in table tennis, and also did spine fellowship. So thank you, Tanay. I cannot go on telling too much about you because obvious reason that no father will praise his son so much, but I would not like to do that. And of course, Vandana, who was excellent and in helping so many mentors. And I made a mistake. I said 500, but it is close to 5,000 that we have actually mentored so far, and many more are likely to come. This is, since now pandemic is over, I'm sure a lot of people are going to be looking forward for this kind of fellowships, and I'm sure all of us will help them, whether it is in UK, USA, whether it is in Europe, and we'll have a second part of Middle East, Southeast Asia, besides Korea, and also USA. And of course, opportunities in India. Tanay, we can always depend on you and your expertise. So all of you, thank you very much for having such a wonderful interactive session. And I'm sure all those participants, I think there are more than 600 participants today, and they'll be absolutely happy. And this is recorded, so we can actually see those recorded versions in future too. So thank you and good night to all of the faculty and the participants. And thank you very much to OrthoTV, especially Dr. Neeraj, Bijlani and Ashok, Shyam, who got all of us together and got this wonderful webinar. And then at the end, the participants who have come in so many large numbers, thank you very much. And God bless you.
At the end, sir, actually, thank you to the moderator, Dr. Ram Prabhoo, for having us all together and helping our younger surgeons and showing them the light, the way forward, some things which in the earlier times the mentors could not do, but now we have access. And thank you so much for organizing this webinar, sir.
So I know in almost 40 years ago, I did a 1 year's fellowship in Germany in spine, arthroplasty that time, and arthroscopy. This was the beginning. But I know how difficult it was to get into the fellowship thing. And, I tried all my skills and sort of buttered quite a few people. Finally, Professor Holz obliged me. And I was one of the first few fellows to Germany. And I also had about 3 months stint at the spine center in Werner Vicker Clinic. And that gave me insight into a lot of things. Besides the orthopedic skills, it is the etiquettes in the theater, the punctuality. The punctuality is very important for any. So in case if you are punctual, go 5 minutes before anything starts. I think they appreciate that. And being interactive, and I learned German, especially went to a German classes for 6 months and learned German. So almost about 50-60% of the Germans, they would speak and I could understand. I forgot over a period of time German, but the orthopedic skills I have continued to imbibe. And there are lots of things, besides orthopedic that I learned. But one of them is how to be professionally talking to the patients, being cordial, giving them importance, listen to them, and the research. The research was something phenomenal that time. The documentation is extremely important. I also had a stint with Professor Gustillo, and he in 1980, when he became the head of the department, turned the whole tables. He said the documentation is important, and that's the time he totally revolutionized, made the whole department digital and computerized. And that's the reason why he came out with phenomenal almost 20 patents, including his Gustilo's classification. I mean the joints. Various joints have been named after him, and right at the age of 85 and 90, he still continues to do research. And I had an opportunity to go to his place at Philippines recently, and he allowed me to participate in the surgery of femoral nail, which he has started now. The different femoral nail, which doesn't require a C-arm, and he can still do interlocking nail. So anyway, that's besides. Thank you very much, faculty, again. And Vandana, Pranav, Tanay, and of course Ashok for getting us together today. Thank you.
Good night, sir.
And
Bye
Thank
bye.
you.
Thank you.
Good night.
Bye bye.
Bye bye, everybody.
Good night.
Bye.